So we are starting with the GI system, the GI tube. We are going to study in series of different GI tube sections. Now, in case of the GI tubes, there is a basic easy rule that we have to understand, and if we understand that thing, we memorize these things. All the content of the GI tubes or microanatomy is easy for us. So there is an easy formula which this particular GI tube follows, and if we do remember about that formula, how these particular things are structured, we can accommodate little variations which are present in some of the segments, but rest of this basic architecture of gut tube or intestinal tubes are same. Now, we are starting with the esophagus, then we are going to move this to the stomach, then we go small, large intestines likewise and appendix. This is how we are going to proceed through, and we are starting with the esophagus today is a GI model. Now, whenever we are going to study this particular GI model, you have to consider that this particular tube is a tube. That means it's a kind of like any circular tube which is having a cavity or hollowness or has a lumen in it. So, it has a lumen inside. Now, this particular tube that we are going to talk about have some layers, and each of this particular layer is similar or more or less have got exact replica in rest of the things. Only thing, it has a little bit modifications and the variations in each of them, and we have to accommodate that particular variations is present as individual GI tube is there. Now, going to this particular basic architecture of these things, this particular tube in the GI system have got 4 layers which is more or less universal. Now, you have to remember this layer inside out or outside in. So, whatever is suiting you, if you are going to remember from inside out or outside in, it is up to you, right. Now, inside out means there is a lumen, and surrounding the lumen we have a layer, then we have second layer, then we have a third layer and fourth likewise, or most outside layer, then inner layer, then innermost, or then you have the lumen to it. This is how we are going to see. Clear? So, we have a cavity inside, we call them as lumen, and then we have surrounding layers or wrapping. Each of these layers have got different features that we have to understand, and holding that particular features, some of the segments have got little different architecture or little different variations. That is it, in a tube it is there. Now, let us begin with this particular esophagus. It is kind of like a food pipe, and this particular food pipe starts from this particular lower end of our voice box or larynx, and that ends into the stomach as it takes it down. Now, what this particular pipe is meant for, to carry the food particle we are eating or swallowing or chewing, and that needs to be delivered to the gut. So, this is a transportation tube which is going on. Now, this particular transportation tube have got some kind of neural wiring, so that this particular food particles is going to go with the gravity, but it needs some kind of pushing. So, we call this particular pushing power in this particular GI tube as peristalsis, and reverse to that, if you want to have a back gear, we call them as antiperistalsis. Now, this peristalsis and antiperistalsis is basically a muscular movement, right. So, if you are going to move something, squeeze thing out, that means you need some muscle to push these things out, clear. So, if you want just like lift this thing or drop these things, you need some muscle power, right. So, it has some muscle for sure. So, architecture of this particular tube consisting of some muscles, of course. Now, if you have muscles in it, you need something to move the muscles, right. So, if you have some muscles in it, that particular muscles need some nerve supply, and that particular muscle needs some blood supply to eat and to survive, oxygen, etc., etc., and as well as to just like drain out this excreta. That means whatever the products is there need to be thrown out. So, this blood should be going in, and oxygen, carbon dioxide or excretas need to be taken out. So, these things will be there. So, it has some kind of muscles, it needs muscle to move some nerves, and this particular like a region have got blood supply to survive that particular elements, clear. Now, this particular muscles that we have is not under voluntary control. That means we cannot move our esophagus muscles. So, these are involuntary muscles, they are present. And the nerves which are present, they are also involuntary. That means we cannot make that, hey, esophagus contract like 10 times a bit. You cannot do that. You can just like pick up a dumbbell and say, hey, all right, I will do 50 times like this. You can do that, but you cannot make this particular esophagus or do like, all right, give like contractions of 10 millimeter per second and this particular length and for these particular hours. It's not like that. So it's beyond our control. The nerve is our beyond control, but it is controlled through somewhere else, which we do not have a control over. Clear? So those nerves which are present, we call them as enteric nerve system, which is a part of autonomic nervous system. We call them as enteric. Enteric means gut system. So we call them as enteric nervous system. Clear? So we have some muscles, we have some nerves, we have some blood vessels which is existing in it, which is we know by this time, easy way, but we do not know where this particular muscle layer exists. So that's what we are pitching in slowly. Now going to this particular area of the tube, we also know there is a lumen. That means there is a cavity. Surrounding this cavity, we have a layer which is present to it. So that layer immediately surrounding this particular lumen, we call them as mucous layer, or also known as mucosa. Under to this mucosa, we have another layer, we call them as submucosa. That means sub means below, submucosa. So mucosa, assume that it is a carpet in the floor. On the floor it is carpeted, that means that is the mucosa. Like this one, it is carpeted, right? Under to this carpet we have a wooden structure. That means this is mucosa and under to it, clear. Now then we have this particular, under to it we have this particular muscle layer, clear, and most outside to it, to cover this particular thing, we have another layer which is a wrapping layer. That means we carry the food and in wrapper, so it not spilling over, it is not falling in elsewhere. So that particular wrapping, outside wrapper, we call them as serous layer, also known as serosa. So which is a packing layer, thin packing layer, which is considered to be fascia. You have seen fascia in that. So it's a kind of facial layer, clear. So we have 4 layers, inside out, mucosa, carpet, then we have submucosa, muscle layer, serous. Now out here in this GI tube, we have 2 kinds of muscle. One muscles are aligned longitudinally and other muscle is circular. So outer muscle, that means most outer one is outer longitudinal and inner one is circular. That means some muscles are encircling. That means just like if it is a heavy lumen, is circular, and other muscle is directed in the 90-degree angle. We call them as longitudinal. They may have some other layers as well. In some of the layer they have a variations. So you have muscle layer, and this particular muscle is innervated by what kind of nerves? Enteric nerves. Enteric nerves, what kind of nerve? Autonomic nervous system. That means we do not have control over, but somebody else is controlling it, right? And most outside layer is the packing layer, this serous layer or serosa. Now to break it down little more further, so we take the first layer, what the carpet layer we call them as mucosa. Now this particular mucosa is fitted with this particular cells, we call them as epithelium. So we have a cell layer, we call them as epithelium. Now where this epithelium is sitting on? Basement membrane, we call them as lamina propria in here, lamina propria in which is studied. Now in this particular lamina propria and this particular epithelium cell layer, we have additional a thin muscle layer which can move this particular epithelium layer. We call them as Muscularis Mucosae. It's a kind of a special layer which is lying under this particular lamina propria and this particular thin muscle layer moving this particular carpet layer, that means mucosa. So this mucosa is consisting of 3 content: epithelium, lamina propria, muscularis mucosae. Clear? Right. Then we have this under to carpet layer, submucosa. Submucosa is fitted with the blood vessels, fitted with lymphatics, fitted with nerves. Okay. So the wearing of these things are there. The epithelium do not have blood vessels. They receive the blood vessel which is left on this undercarpet layer and it diffuses out. That means the train reaches to this particular undergarment tunnel and drops this particular lodge, whatever it has it, and then slowly it spreads out to this particular epithelium layer and it gets the nutrition from there. Clear? So, if he is this epithelium layer, he is not having the blood supply to it. Neither this guy, neither this guy. Under layer is receiving the source and from there it is reaching to them. Clear? Alright. So, we have this submucosa have got blood vessels, nerves and lymphatics. Then we have the muscle layer. Muscle layer also have what? Blood vessels, nerves, lymphatics, etc. etc. Clear? Now, in addition to this submucosa have got some glands inside. These particular glands we call them as submucosal glands. So, this mucosa under to that carpet layer we have these blood vessels, we have these nerves, we have these lymphatics and some glands is there. We call them as submucosal glands, right. Then we have this muscle layer. What muscle layer we have? What this muscle layer having? But not the glands. Outer layer? Outer longitudinal. After that? Serous layer. Serous layer is a tough fascial layer. It has cells, collagen fibers. Clear? Now write it down, whatever the layers you have learned. And draw a schematic picture, how it should be looking like. And once you draw it and write it down, just like in bullets, like don't write a essay like I don't want you to be Tagore, okay. I just you want to be something like don't want you to be something like Leonardo. Just draw something which is really beautiful and in Louvre we are want to go show it there. Just like write in bullets like whatever the things you should be expecting to see in this particular gut architecture or GI architectures. And once you write it, you can check it with your friends. Just like cross verify, always cross check. What did I miss? It should be something like this. This is a simple form of architecture, how it should be looking like the GI tubes, right? It should have some layers. Each layer have got some residence in it. That residence depends on whatever the content and the structures you are seeing. Say for example, the inner layer we call them as mucosa. Mucosa have got three layers, epithelium, lamina propria and a muscle layer. Then you have submucosa. Submucosa have got glands, nerves, blood vessel, lymphatics, etc. etc. Then muscle layer. Muscle layer also have got same features, having this nerves which is enteric nervous system nerves. We have a special name to them. In physiology you are going to learn that. Myenteric plexus, orbex plexus. These are peristaltic or anti-peristaltic nerve fibers. Either they are making this particular food particle go or reverse. Then we have outside layer, the serosa. Serosa is having a cellular layer, a collagen fiber, and you will look at this particular serous layer. Through this serous layer is basically what are the blood vessel, nerves, lymphatics is moving in, and then it is breaking down and reaching to this particular point. So this is basically giving us a gateway through this particular thing is going, and then it is making a tight seal to it, right. So this is a basic architecture which is present to it in GI tube. That's what you will learn. Now we are landing up into the structures that we have in, this is the thing which you talk about, mucosa, submucosa, muscularis, adventitia, right. And how does it look like? It should be that. Now we are landing into esophagus. The esophagus, what you have to understand, this is the basic same similar structures. So schematically it should be looking like the same. Lumen, then after lumen what structure it will be there? Mucosa. What mucosa is consisting of? The same ABC. Then submucosa. What the submucosa is consisting of? We understand. Then muscle layer. Then serous layer. Clear? The same thing. Easy peasy. Now what you have to understand, this particular mucosa, the cells. What is cell lying there? Epithelium cells. These epithelium, what kind of epithelium cells? Stratified, squamous, epithelium, non-keratinized. This is the only exceptions. Rest of this particular GI tube is either columnar or cuboidal. So this particular region of the GI tube, gut tube, is basically having this stratified squamous epithelium cells. What do you mean by these things? If you break it down, stratified squamous epithelium, how many layers are there? One layer, right? No, one layer. No, one layer. Stratified. Stratified. That means, how do the cell look like? Strong, big, tall, right? No. Strong, big, tall. You are wrong, right? What kind of cells are there? Flattened cells. Looks like egg pouch. Egg pouch. Flat cells with popped up nuclei. Right? So these cells are stacked on each other. Right? So stratified squamous epithelium and non-keratinized. These are a word of religious book. Whatever the religion you believe in, you have to remember that. No exceptions. Stratified squamous epithelium, non-keratinized in single breath. Okay. Then Lamina Propria, which is having this particular Muscularis Mucosae under to it. Then we have the Submucosa. What Submucosa is consisting of? No wonder, no surprise to it. Glands, vessels, nerves, etc., etc. Muscular layer, externa. That means outer longitudinal, inner circular. Right? Some of these areas have got some modifications. Just let go the modifications. We just like want to know the basic things. Then Serosa layer. Functions of this. You understand this? Function of esophagus is to transport. No absorption, no digestion, nothing else. Just carrier guy. Then it should be looking like this. So if it having the lumen out here where I am placing the cursor. So what layer it will be? Mucosa. Mucosa is consisting of Muscularis Mucosae. Then under to it Submucosa. Then Submucosa to muscle layer. Then Serosa layer. You know how to trace it? You understand how to trace it? So easy? You made it on your own, right? You did it. It should be looking like this. Now go see and check the microscope so whether it's fitting with your things so that you have learned.
Yes, sir.